Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us once again for our weekly update on Delaware's response to COVID-19. We hope that you had a happy and restful Christmas. And now as we move into Christmas week, into New Year's, we have some really important information to go over and to share with you so that you can be safe, happy and safe in the new year and in the New Year celebration, and be careful. That's our fundamental message today as the COVID-19, Omicron, and Delta viruses surge across the country and across our state of Delaware. We're joined today by Secretary Molly McGarrick, who has been with us many of these press conferences. We appreciate her leadership there at the Department of Health and Social Services, her teams at Public Health, doing incredible work now over almost 2 years with COVID and response, and going from a period in time where we had very little knowledge and experience in responding to something like this, to a time now where we continue to address the challenges that we meet, and we have some significant ones as we face the new year. We're also joined today by our hospital partners in the mid-state and lower part of our state, the Bay Health Medical Center, Chief Medical Officer, Dr. Gary Siegelman. Dr. Siegelman, thanks for the work you do every day in leading Bay Health in your position, and for being with us to share thoughts about the challenges that you're facing. And Dr. Ellie Silinski, who is the Assistant Medical Director of Emergency Services, so particular challenges there on the emergency services side, not just with Bay Health. Last time we had leaders from Christiana Care who shared with us the situation there at Christiana Care. I think it's fair to say that the situation in all of our hospitals, from northern Newcastle County to the Maryland line in Sussex County, is dire. Our hospitals are over capacity. Our emergency departments are being stressed. Part of that is COVID related, and part of it is just additional people needing hospital treatment. And we'll hear from our physician partners at Bay Health about the challenge that they face. So let's start with the data as we normally do. And again, thank Dr. Siegelman and Dr. Silinski for joining us, and Secretary McGarrick. So sadly, the new cases are really surging. We're over 1,000 on a 7-day moving average. A lot of that is increased testing. Obviously, the concern with being, and that's a good thing. So people are getting tested to find out whether they're positive as they join family members, college students coming home, other family members joining, and that's happened in my big and extended family. Tried to keep separate and with indoor locations and careful, limited those celebrations. Our positive tests are up to 15%. Again, on a 7-day moving average, those test numbers go up and down depending on the day of the week. Obviously, you're not going to have many people getting tested on Christmas Day, but maybe the day after or the day after that. But so this is a 7-day moving average. You'll remember there was a time during the summer where things were really good, when we were under 1% in terms of the percent positive. Now we're up to 15%. The World Health Organization target is under 5%, so we're 3 times that. Is that very concerning situation? Most important of all, the number that you've heard me refer to week in and week out, the one that I look at because it's very tangible. The people that are hospitalized with COVID are counted by our hospital teams in each of those facilities. We're up to 454, which is below our peak of early January, but still at a level as we move into New Year's and the aftermath of the new year, the expected hospitalizations that we'll see then. My hope, as you've been hearing me say for some time, was that we would peak before reaching that total of last January. We're on pace to surpass that, which is not a good thing, and we'll hear from our hospital partners about the challenges that they face as a result of that. So here's the roller coaster ride, going all the way back to the beginning in April and March when we first started taking this data. And the peak, last year's peak, just again, right where we are today, going into the New Year's celebrations. And you can see we hit the peak there in January of last year at 474, the second week in January. So some time for that virus to take effect on individuals and for them to find their way to need the kind of hospital treatment that one needs. And so then after that, pretty steep decline in January and February, and then the roller coaster as we see it now. We came off a little bit. There's a big difference between where we were last year, this time of year, December and January, where there's very little vaccination happening, very little availability there. We were just vaccinating people that were 65 and older, individuals that were in long-term care facilities, our frontline hospital and healthcare workers. And so now, as we look at the current peak there on December 28th at 454, we do have significant percentage of our population vaccinated. But what we're seeing is the vast majority of those people that are in the hospital with COVID are people that are unvaccinated. So it's really pretty simple solution to this dilemma, this situation, which is if you're not vaccinated, get vaccinated. If you are vaccinated, be careful, wear a mask when you're indoors, in particular, just as an extra precaution. So let's look at that surge in hospitalizations in the context of other patients that are being hospitalized. And here's where you can see the problem. If you go all the way back to April of 2020 at the beginning of this COVID situation, you can see the surge in hospitalizations there at the beginning, the bit of a roller coaster ride. Again, the dark blue is the COVID hospitalizations. The gray is everybody else in there for non-COVID related. And so the census at times, hospitals shut down their elective surgeries as they're doing now. They depopulated in various different ways as they're able to do. But the overall census today is driven by a combination of our COVID cases, which are preventable. People get vaccinated. You're not going to, overwhelmingly, not going to find your way to the hospital. And that's a fundamental message today. This situation that we're seeing at the end of December, this is actually a mid-December number, is creating the dire circumstances that you're going to hear from Dr. Segelman and Dr. Silinski in a few minutes. And here's the simple fact. 78% of the hospitalizations were people that are unvaccinated or partially vaccinated. So it's not just people that haven't gotten any shots, but if you've only had one shot, you haven't been boosted, we need you to get that done. And for those of you who are unvaccinated, it's really important that you wear a mask when you're in public, in indoor spaces in particular, and at the risk of getting or transmitting the vaccine to others. So here's our vaccine update. We've delivered over 1.5 million vaccines to Delawareans. About almost 65% of Delawareans, 624,000, are fully vaccinated. That's really a good number, particularly when you compare us with other states and all the folks that have been out there, got their shots, been very vigilant about it, talk to those people all the time. We thank you for that. You're protecting yourselves, you're protecting others, your neighbors, your family members. And, in my case, I'm protecting my 90-year-old mother, who's also fully vaccinated and boosted, but she also has 8 or 9 sons and daughters who are coming in and out of her house. And I'm always trying to make sure that they are fully vaccinated as well and wearing masks when they go to see our mother. Here are the overall state numbers at the bottom. 68% of Delawareans who are over 5 years old are fully vaccinated. And you've got, of course, there are Delawareans under that age that are not eligible, and 73% for 12 and over, 75% 18 over. And of course, those of us who are 65 and older, we know how vulnerable we are. And overwhelmingly vaccinated, 100% with at least, almost 100% with at least one dose, and 93% here fully vaccinated. Just incredible numbers there. But here's the problem in the next slide. If you look demographically, both and geographically and in terms of age demographics, in our young adult group, say 12 years old or 17 years old to 49 years old, you have less than half of the population in the lower part of Delaware and Kent and Sussex County, the catchment area, and large measure for our hospital partners that have joined us today, less than 50% fully vaccinated. So if there's a message, if there's a solution to the challenges that Dr. Silinski, Dr. Siegelman are experiencing, it's get vaccinated. It's get vaccinated. We know even a higher percentage of their patients in the hospital with COVID are unvaccinated than the number of the 72%, 71% that we talked about just a minute ago. Again, once you get up into 50 years and older, each of the 3 counties and statewide, the numbers are pretty much the same. It's really those age groups, from the late teens to 40 years old, where we've got to step up our efforts to get vaccinated. On boosters, again, if you are fully vaccinated, you still need to get boosted, and we're lagging a little bit behind there, even with our 65 and older population, which is just there below 60%, and then it gets lower, obviously, down to 18% for 18 and older at 37%. So if you haven't gotten a booster, you want to get that extra protection, particularly as we see the surge coming with Omicron. Most of our cases today are Delta, more severe, more likely to put you in the hospital, we think. But Omicron is coming. It's been in other states at greater percentages, and it moves like wildfire through a population, which is part of our message today and concern. So in order to enable us to help our hospital partners depopulate and move patients from the hospital emergency rooms and beds in the hospitals into long-term care and other assisted facilities, we need some emergency powers. And so I'll be declaring a state of emergency effective this coming Monday on January the 3rd. It will give us additional flexibility to help manage the COVID-19 surge. It will enable, we've got a really, we think, good program of training up members of our Delaware Army and Air National Guard to work as CNAs in skilled nursing facilities, helping with the staffing needs there, enabling our hospitals to discharge patients out of their facilities, to depopulate there, move them in to a longer care and assisted care facilities. So we've got about 100 members of the Delaware National Guard. I want to thank General Berry and his people once again stepping up in a big way to get trained quickly so that they can help with this hospital situation that we're seeing. So everybody can chip in to fight the surge. Residents really need to understand that the Omicron variant is very virulent and very contagious. Hopefully it's not doesn't bring with it a serious sickness, but we'll see. But we need to get everybody recognizing that if you're not wearing your mask in public places, indoor public places, you're putting yourselves and others at risk. I hear all the time, including conversations I had with business leaders in our state this morning, that there's so much spread among people that don't know they're carrying the virus because they're not symptomatic. And so it's important that you take the extra precaution by wearing a mask indoors in public. Protect those employees of those facilities. I was in my Wawa this morning. They were commenting about 80% of the people that come and go are wearing their masks. All their employees are wearing their mask, and they've had minimal outbreak there, but still, they take a person or two down and they're not able to fill the shifts. And that's just one small example. The hospitals are experiencing that in a very more serious way. Businesses, again, I mentioned talking to the business leaders. we need to protect your workers and customers. So we're encouraging you to require masks. We think you requiring the mask is a better way to get the objective. And we understand that you know better than we do your operational needs. We're 2 years into this, and we expect business leaders to step up and do what has to be done. As we are in the state, we do have a mask mandate for all state public facilities, public transportation, hospitals, long-term care facilities, healthcare facilities are subject to that mask mandate. Our partners at the University of Delaware, Delaware State University, have mask mandates as well. And so we need private businesses to step up to the plate as well. Here's the message: thinking about New Year's, your party that you want to go to, or the bar or the restaurant, you'll likely have an uninvited guest at your New Year's party. And it's someone who is maybe asymptomatic, but positive with either the Delta or the Omicron COVID-19 virus. And so you got to be careful that you're not bringing it in to your party or the restaurant that you're going to, and that you're protected from somebody else who is carrying it. Bottom line is, if you're not vaccinated, get vaccinated. It's the most important thing that we can do. As you think about the challenge that we're facing today, as we face the Delta variant and Omicron coming, it's really about making sure that as many people as possible that are not vaccinated can take that step for their own benefit, the benefit of their family members, and to prevent this surge from further stressing our hospital partners. And you're going to hear from two of the leaders at Bay Health Medical Center, Dr. Siegelman and Dr. Silinski, who will share with us what they're experiencing in their facilities. We'll hear from them in a minute after hearing from our leader at the Division of Health and Social Services and her team at the Division of Public Health, Secretary Molly McGarrick. Secretary McGarrick, thanks for joining us again. We appreciate everything your teams are doing.
Thank you, Governor, and thanks for the opportunity to be here today. So as we saw on the Governor's slides earlier, we really are at a pivot point, and we really have two of the same virus circulating. We have the ongoing Delta wave that started in November and is now being quickly overtaken, and we continue to see the Omicron variant spread like brush fire throughout the state. And so we know that what that has really translated to this week is test kits and testing is the hottest commodity right now. We are, by point of reference, in June, we were doing about 1,000 tests a day. On Monday, we did 13,000. So the teams across the entire state, whether it's the National Guard, the curative, the public health sites, have absolutely stepped up testing and have offered options in the community. We moved away from the massive test sites because we know that people getting access to tests in their community actually increases equity. Not everyone can go to a drive-through site. Not everyone has a vehicle. So we continue to respond to this and are providing testing. Another way that we're doing this is ensuring that vulnerable and underserved populations have access to the antigen testing kits, the ones that you see at the grocery store and are $26 a pop. We know, unfortunately, that can be cost prohibitive for populations. We also know that many of these communities have a lot of the frontline workers that don't have the option to skip a day of work, maybe don't have paid sick leave. And so we want to ensure that while we continue to have robust testing options through the curative and the public health and the guard sites, we're still making sure that we're being responsive to individual communities that may have challenges with access. In terms of, next slide, please. In terms of, again, need a test, it is going to be challenging. I don't want to sugarcoat it that demand is absolutely outstripping supply. At the same time, we have a very dynamic situation where the people who run the test sites are struggling with their own employees testing positive due to some exposures and getting together over the holidays. And so I know this is a very tough ask, but to ask people to be patient. I know it's a source of panic when we want to be able to do something and we can't do it. But we would ask people, again, please try to book in advance, but realize that due to things that are beyond control, including people getting sick and being unable to go to work, we may have appointments canceled. You may be waiting in lines. And so that is absolutely impacting the situation. I would be remiss if I didn't give special thanks and recognition to not just the state employees and National Guard partners and our curative partners that are really the backbone of our testing infrastructure, but we know that health systems and private labs, places all over the state have really stepped up and offered testing, and they have experienced, in some cases, violence and belligerence by people who have sought testing. And so it has been a really difficult week, but they've continued to show up and be there so that people can continue to have access to testing. And so I want to give them special acknowledgement and thanks. And again, tall ask, but would just ask everyone to please understand that this is an extremely challenging and dynamic situation. Everyone is doing the best they can. But when everyone in the state wants something at the same time, even the best plans and resource management is just not going to be able to keep pace. So we hope demand will settle back down, but it may be a bumpy next week or so as people continue to need to and want to get tested. Next slide. So one of a key point of my presentation, but I want to move relatively quickly through this because it is complicated and we're going to have the slides online and be doing more education around this. But many of you saw that the CDC changed the guidance around isolation and quarantine earlier this week. I want to reassure people this is based in the science, that what we are seeing and is becoming more clear as we're living with this virus is that people tend to be infecting other people and shedding virus in the 1 to 2 days before they start having symptoms or test positive. And then they continue to really be at their most contagious in that 2 to 3 days after the positive test. So that is why the CDC moved the isolation window, if you are COVID positive, from 10 days at home to stay at home for 5 days, and then well-fitting mask and ability to go out in public or go to work after for the remaining 5 days. Next slide. And this is subject to, as with everything, there's a caveat with these this guidance, but this is really subject to if you don't have symptoms. As the governor said, we are seeing people because we are 2 years into this and people have some measure of immunity. We're seeing people who get Omicron, maybe not have the same level of symptoms or be asymptomatic. So this new guidance is based on the fact that you don't have symptoms on that day 6 when you would be going back to the public, back into public or work. Next slide. And this is a bit of a change, and again, to be candid, this has to do with the volume of tests. And really what we're seeing is we are asking people to bring it upon themselves to please notify your close contacts. We don't know, and at this point are struggling with the volume of cases and processing. And so we do not have the ability to contact trace and notify and do that extensive interview for every single positive case. So please, if you are positive and you know that you got together with friends, we would ask you to let them know that you have turned positive and that they should be considered a close contact. If you're symptomatic, again, cold, fever, sore throat, aches, please stay home until your symptoms have either resolved or you're on the mend and have not had a fever for 24 hours. And, please, if you do have difficulty breathing, chest pains, anything that would indicate that this is a severe infection, please do not hesitate to seek care. We know we've been talking about hospital volumes, but we do not want that to deter. All of our health systems are ready, willing, and able, and staffed to provide emergency care to people in these type of dire situations. Next slide. So again, this is now the quarantine side. So if you have been exposed to somebody who has tested positive, we're asking you to stay home. And if regardless of your vaccination status, we're asking people to get tested on day 5 after exposure, again, regardless of vaccination status. If for some reason you have symptoms, please, again, immediately quarantine until you get a negative test that confirms that it's a cold, it wasn't COVID. Next slide. So again, this is where it can get a little confusing, but as what we saw previously, if you have, the top of the vaccination series, so now you've had both, like in my case, I had both of my Moderna doses and I've now had my Moderna booster. So if I become a close contact of somebody, I do not have to quarantine per this new guidance, but the request and direction from CDC is to put on a well-fitting, high-quality mask, just in case for some reason I am positive and potentially shedding virus to other people. So again, it's 6 months. 6 months from your Pfizer Moderna, 2 months for J&J, you've had your booster, please no quarantine. If you have not had your booster dose, either dose 2 for J&J or dose 3 for Moderna and Pfizer, you will have to quarantine because we are again seeing those individuals more likely to become positive and symptomatic, especially in the face of Omicron. And if you are unvaccinated, we need you to quarantine again for 5 days and wear the mask around others for 10 days total. Next slide. And again, this goes to the previous points of unprecedented demand, and wanted to put this out there because we know that there are some employers that have said that they want a clearance letter from the Division of Public Health before they will allow their employees to come back to work. We are no longer able to do that. We hope that that's temporary, but we have really redirected our outstanding EPI team to process and get positive cases processed and posted on the website so that we can have the most accurate and fullest picture of what positive cases exist in the state as quickly as possible. Again, that means there are trade-offs. They are not going to be able to do the clearance letters anymore. We will be communicating this further, but if you know that your employer requires you or you are an employer that requires that clearance letter, again, not a DPH requirement, but something that employers have done, please be aware that that is not something we are going to be able to provide for the foreseeable future. Next slide. And so this is the, I'm going to echo the governor. And I think if people do not take away anything from this presentation, please listen to this. If you are gathering with people indoors and you do not have a mask on over this next week and on New Year's Eve, you should expect to become positive with COVID. I'm not saying you're going to be severely hospitalized or that depends on a lot of factors, but it is everywhere. The Omicron variant, you can see in cases from surrounding states, we're hitting record totals. We're going to hit another record total of cases today. Omicron is everywhere. And we've yet to be able to figure out how to eat and drink through masks. So we see people who are very vigilant wearing it to and from the grocery store. But if you're having a dinner party, if you're getting together with somebody for coffee, that is where this spread is occurring. So please, if you go out on New Year's, please do so with the understanding and expectation you very likely will test positive for COVID in the next few days after. And because of that, please be careful about what you do. I would not advise you, I will leave the medical advising to doctors, but if it were me personally, I would not then go hang out with an immunocompromised grandmother. I sure as heck wouldn't hang out with the governor's mother. As he said, 90 years old, God bless her, she's amazing. But I would not put her at risk knowing that I was likely exposed to COVID if I went out on New Year's Eve. This is also a wonderful opportunity to be creative. It's going to be 60 degrees tomorrow. That's a whole other conversation on why that is, but you can go outside. There is a whole range of options for people in between staying in your house forever and jam-packed holiday party. Take a walk, have an outdoor gathering, a true outdoor gathering, not fully enclosed in a tent and thinking it's outdoors. But please, please, please know If you are gathering indoors right now, somebody COVID positive is in there gathering with you, and Omicron is so infectious that you will likely become positive. So with that, I think next slide. And again, we are a broken record, but the fundamentals still remain. Get vaccinated, wear a mask in settings where you don't know people's vaccination status and you're going to be indoors for any length of time. You are at risk for getting COVID. Get tested after you get together. I know that's going to be challenging for the next couple weeks. If you have positive, if you think you're positive and you have symptoms and you got together, act accordingly. Stay home if you're sick, and please wash your hands regularly.
All right, thank
Governor,
you, Secretary McGarrick. That presentation was pretty direct. Obviously, there's some complexity there in terms of contact tracing, but if you do have a positive case in your household, obviously, or if you have been tested positive, all the folks around you need to quarantine so we don't have further spread of that virus. That's a really important thing to do and really important information to understand. A little bit complicated, and with the new CDC guidelines changing on us to a good way, actually, but a little bit confusing. When you have so many positive cases, our team that does the contact tracing, that reaches out and finds out other folks that need to be notified, gets stressed to the limit. And so, as Secretary McGarrick mentioned, you need to follow those guidelines and make sure that you're quarantining when you come in contact with someone who tests positive. We're delighted today to have representative leaders from Bay Health Medical Center there at the lower mid part of our state and lower part of our state, so that to share with us what they're seeing in their hospital facilities. We want to thank them for coming today. Thank all their workers that have been on the front lines now for almost 2 years. We've got a great relationship with our partners across the state, and we appreciate very much Dr. Siegelman and Dr. Silinski being with us today. They're both going to do a tag team on this last part of the presentation. And with that, I turn it over to them.
Thank you, Governor. And I want to thank the Secretary and your staff and you for giving us the opportunity to talk today a little bit about what we're seeing in Central and Southern Delaware at our Bay Health facilities. If you take a look at the slide that's up here, and Governor spoke about this a little bit, we've been seeing a rise in cases in Delaware it looks fairly similar to what we saw last year in December as we head into January. But there are some important differences. The things that are similar are that the overall number of hospitalized patients in the state of Delaware is about 450 right now. The peak last year was around the 12th of January. But what we've seen at Bay Health and what we're actually seeing in the state as well is that the rise in the month of December has been more rapid than it was last year. And as we talked about with the Omicron variant following up the Delta variant, it's very possible and it's likely that we'll see a much bigger surge in January. So we need to be prepared for that. We need to try to limit that as much as we possibly can. We have currently, and I'll talk about this on the next slide as well, but we have about 35 to 40% of our beds are occupied by patients that have COVID. Our numbers have increased. Our number of COVID patients in the hospital have gone up by about almost 50% in the last 20 days. And if you were to continue that for another 20 days, it would mean that we have over 50% of our beds are occupied by COVID patients. So one of the big issues here is we're trying to maintain the best possible care we can for patients. That is our mission. That's what we're here to do. And we do need your help because there are a lot of other people in the community who are very ill with non-COVID related issues. We need to be able to take care of them. We need to have the capacity to do that. And even though we've increased our capacity by adding more beds in several different ways, we still are stressed significantly by what's been going on. So if you look at this slide, and this speaks to us, and I think it speaks fairly well for the other hospitals in the state of Delaware as well. We basically have been staying around capacity or higher even for the last few months, both our inpatient beds and our ICU beds. We have COVID patients both in the ICU and in regular patient beds. But between those patients and the ones that many folks that perhaps delayed their care and have been have non-COVID issues but come in very sick, we have a very sick set of patients in the hospital right now. And we see that, you know, as soon as someone gets discharged, we have someone, another patient that's ready to come and take their place in that bed. So we are, again, talking about the fact that we're functioning at capacity. And one of the things that's different now from what it was a year ago, last January, is that our staff have now been at this for 2 years. Our staff have done an incredible job, but they have been under a tremendous amount of stress, working long hours for just about 2 years now. So it's very tough for them, and it's even tougher than it was last year. So one of the things that and we can go on to the next slide. You know, one of the key messages, again, we're repeating some of what was said earlier, but this is very, very important. This is a statement from all the hospitals in the state of Delaware and the Hospital Association talking about how difficult the situation it is right now. If hospitals have over 50% of their beds occupied by COVID patients in a month, you know, we would be really, really stretched to take care of everyone else that needs to be cared for. So we need to try to do the things that the governor and the secretary have spoken about. And I'll talk about that a little bit right now. One of them that's been repeated many times, and it sounds like a broken record, is to get vaccinated. Getting vaccinated and staying up on your boosters is absolutely critical. That means, you know, with Pfizer and Moderna, it's 2 vaccines. With Johnson & Johnson, it's 1 initially. And then everyone needs to get a booster unless they've had their first vaccine recently. Something that I think is interesting, it's a really helpful study that came out just 2 weeks ago from the Commonwealth Fund, which is a very reputable research organization, came out on December 14th. They looked at the data for the last year, and their findings show that we've saved in the US about 1 million lives that would have been lost from COVID if we did not have vaccines. They also stated that about 10 million hospitalizations have been saved. We would have had 10 million more. And they also said that the total number of cases of COVID in the US would have been 35 million higher. So all those statistics are pretty remarkable. I mean, having a vaccine that can save 1 million lives in 1 year is an incredibly potent resource that we should not waste. So that is really a key message at this point in time. As others have said, a mask, whether or not you're vaccinated, is critical. Anytime you're inside with other people, basically anytime you're inside with others, and maintaining social distance and good hand hygiene as well. Those are some of the key things we wanted to mention and to reinforce. You know, our booster numbers in Delaware are not as high as they could be. Our booster shots are around 30 to 35%. And the boosters are a really key part of what everyone in Delaware needs to keep themselves and their families safe. Another couple things I want to talk about, and I think we can go to the next slide. So we want to make sure that we have care available for the patients that are ill. If you have a heart ailment, diabetes, if you have emphysema or worsening of any sort of condition that you have, you should absolutely come to the hospital and come to the emergency room or the appropriate setting to take care of that illness. But for people that have concerns about being infected with COVID and are generally feeling pretty well or have some mild symptoms, it's not necessary to come to the emergency room. And in fact, you should not be coming to the emergency room in that situation. Again, if you are worried about being infected and only have mild symptoms or no symptoms, you should go elsewhere to get tested. You can go to the testing sites, some of which are listed on the website listed here on this slide. There are commercial companies that provide testing in the state of Delaware, and again, the state resources as well. So that's really what someone should do if they're concerned. They can talk to their primary care physician. There may be urgent care that's appropriate, but unless you're really sick, you should not be spending the time and that are needed for people that have significant issues and are being seen in the emergency room. Again, if you're really ill, you should come. You do need to take care of yourself. But if you have mild symptoms or no symptoms and are just worried about COVID, you should go get tested at an outpatient facility. So the other thing that we want to encourage people to do is to, again, as others have said, be responsible. You're taking care both of yourself and your family members and your community by getting the COVID vaccine and by using the mask and socially distancing. Our staff, who again have done a terrific job, are doing their best. And one of the things in the emergency room that we've seen is that it is taking longer to be seen. We ask that you be patient with them. They have worked very hard, and they are getting to every patient as quickly as they possibly can. So those are some of the things that I wanted to emphasize for today. Again, the vaccine, which we see now is incredibly effective, is something that everyone ought to have and ought to have up to date and boosted. I'm going to turn it over now to Dr. Ellie Silinski. She's one of my colleagues at Bay Health. She is on the front lines working in the emergency department. We're very happy that she's here to share some of her experiences at Bay Health. Thank you.
Thank you, Dr. Siegelman. That was great. What I really liked was the quote about the vaccine preventing 1 million deaths. And I think that's pretty eye-opening. So along those lines, though, I want to, emphasize the fact that it's not a silver bullet. My mom, for example, did everything right. She was fully vaccinated, and she was wearing an N95 mask in public. And unfortunately, she was exposed last week and hospitalized for COVID. But I firmly believe that she was not on a ventilator. She was not in the ICU, and she is thankfully been discharged from the hospital. And I believe that is because she was vaccinated. Another example that I could give you from my frontline work in the emergency department is a couple that I saw about a month ago. It was a woman in her 40s who came in profoundly hypoxic and critically ill. And when I asked her if she was vaccinated, she said, no, because my husband is vaccinated and he got COVID anyway. And unfortunately, she did not survive, but he did. So it's a layer of protection. It's absolutely critically important. If you're on the fence about getting the vaccine, now is the time to get it with Omicron and its increased infectivity. And also the booster is really key to that and has been shown to reduce mortality significantly. So along those lines, I've been out in public a lot recently, as I'm sure you all have, and it's astounding to me the number of people who are walking around in public who are unmasked. So I just really want to make sure that people understand that the vaccine is not enough in and of itself to prevent infection, and that you need to protect yourself as well as your friends and family from getting it. And it is really absolutely important to do that in addition to hand washing and socially distancing. So, I know everyone is getting pandemic fatigue and we want to get back to our normal lives. We want to have gatherings. We want to be with friends and family. We want to travel. We want to have fun. We want to just go back to the way we were, but we all have to step up and, take personal responsibility and, individually do what we need to do to prevent this from getting worse and to fight this battle. Because if we don't do that, I don't know if and when that will happen. So I was also asked to comment on some examples being on the front lines and what it's been like. As you may expect, it has been very challenging to work in the emergency department with progressively more limited resources. And just when we thought things were getting under control, Omicron is now taking hold. So some examples that I could provide. Last week, I was actually working clinically. And Dr. Siegelman, you happened to walk in right when that happened, but we did have a patient who was extremely violent within a few feet of myself. And I did unfortunately watch one of the staff members get physically assaulted. And thankfully, security was able to come and intervene. So these are the types of things that we're seeing. It amazes me that, that person who was assaulted came back to work the next day and seemed to actually have empathy for that patient. In addition to that, I feel badly for our clerk who answers the phone because I hear her getting cursed out on the phone all the time. People are angry, they're waiting. I know people are posting things on social media because they're upset, they're waiting. And I just want everyone to understand that, we are all dedicated to helping patients to serving our community, and we're all doing the absolute best that we can. And we've pushed past limits that we even, didn't even realize that we could surpass. We are all extended beyond what we ever expected, and we're trying the best that we can. And we just ask that the community understand this. Just try to be patient, try to be kind, and a simple thank you does go a long way.
Thank you very much, Dr. Silinski, Dr. Siegelman. We appreciate you coming on with us today to share a little bit the challenges that you're facing there at Bay Health and your campuses in Central Delaware and Lower Delaware. Really appreciate that. That's really the dire situation that we face here in the last week of the month, with the Delta variant surging, with our hospitalization rate now hitting 454, approaching the peak of 474. There's the graph that shows the last 2 years of COVID-19, the roller coaster ride. That's just the hospitalization side. It's not the positive cases, and they correlate to a certain extent with that. And it certainly doesn't talk about the 2,283 Delawareans that we've lost for COVID-19. Everyone a precious life. We all know somebody that's been in that situation. We've heard a little bit about that from our partners there at Bay Health. I know that just recently I went to a funeral of a really well-respected, well-liked state employee, a great leader in our state who succumbed to COVID-19. Not somebody that was older or that had some pre-existing health condition, but somebody just got a really bad case of COVID-19 and ended up passing away. And so we're calling everybody to come together at the end of the year as we're celebrating this season of light and hope, to really lean into the new year and to help us flatten out that curve that we're hopefully right in the middle of with hospitalizations. We've heard from Secretary McGarrick about Omicron now surging more here in our state. Delta still predominant and more serious. And so we need everybody to follow the strong requirements to wear a mask when you're indoors, to keep social distance. If you're sick or feeling sick, stay at home. Don't risk going out and exposing others. Be careful really within your own household, particularly as our family members come and go over the holidays. And by all means, I think twice now about your New Year's Eve celebrations. It's just one more night. You can maybe have a New Year's Eve celebration a month from now when our cases have returned back to earth, if you will. We need everybody to pitch in. We need all of us to come together as Delawareans. We need the private sector to step up as well, to protect their employees so operationally you can stay active. Our economy has really returned strongly to the point where the biggest challenge that the businesses are experiencing is finding the workers that they need to do whatever business they're in. So let's pull it together at the end of the month. Appreciate the media who've joined us today, and I invite any questions that you might have.
All right, Governor, we have a few questions here from the media. We're going to start with Rebecca Baer from Delaware Public Media. Rebecca, allow me to unmute you. Oh, I see she just dropped her hand. Our next question will go to Brandon Holvik from the Delaware News Journal.
Thank you. I'd like to pose this to the whole group, if you will. We talked a lot around the time of the Delta variant about if not enough people were vaccinated, would there be possibilities of future variants of worse transmissibility or more severe. We don't know necessarily if Omicron is more severe, but it certainly seems as or more transmissible based on the data. I guess looking forward, is that still the sort of situation we're in, that if this doesn't get stamped out now in future months or even in future years, thinking about this time last year, will we be faced with future variants? Is that something that people should think about as they're making decisions now about whether to get vaccinated and whether to get booster shots and those sorts of things you talked about today?
Yeah, I'm going to ask the Secretary McGarrick and our physicians to respond to what's more of a science-based question, but I think we're learning more about Omicron every day. We're hopeful that some of that learning is more positive than not. I think one of the things that we know is it appears to be more virulent and more transmissible, as you've said, and we're very worried that it'll run through Delaware like wildfire. Hopefully not drive hospitalizations up further, because you can see the situation that we're in currently at the end of December, just before the peak of last year, a year ago, we saw after New Year's. And so, yeah, those are concerns. We kind of take it one day at a time because things change. But that's our approach. Secretary McGarrick, I know you've read a lot about this and thought a lot about it. We don't have Dr. Rattay with us today, but help us understand the question there.
Yeah, I'll answer briefly and then pass it off to clinical leaders. But I mean, this is what viruses do. They mutate, and they mutate readily as they infect hosts. And so the most readily accessible host is an unvaccinated person. And so that is really why it's not just important that Delawareans get vaccinated, but you're seeing more push on the federal level, including a new vaccine approved out of Texas Children that's going to go to people in countries all over the world. I mean, we really are in this together, and the extent to which all of us can be vaccinated means we don't basically keep running through the Greek alphabet. But I'll leave it there. It is a significant concern that we have to be aware of and defer to clinical leaders.
I agree with what Dr. McGarrick, Secretary McGarrick said, and I would add that viruses, they thrive when they're able to replicate and infect more people. So it's another way of looking at it. So if you have millions and millions more people that are susceptible and a larger number of infections that occur, each one of those situations, there's an opportunity for them to mutate and to, change to a different form that maybe is a little bit more dangerous to us. So by clamping down the pandemic as early as possible, and vaccines and the other things we talked about here are the key ways to do that, that helps prevent, to some degree, some of those other variants from occurring.
Great. Our next question will come from DJ from WDEL.
Hi, all. I was just curious, the new CDC guidance on, not having to isolate for as long seems, I think, instinctually counterintuitive to having a more transmissible variant that is causing a spike in cases. Is that an issuance that you would all follow personally? Can you reassure people that even with this variant, that's a safe time to keep yourself away from others?
Secretary McGarrick.
Yes, so I think this is, we really are at a pivot point in this pandemic where I think when this initially started, we thought, let's, really try to stamp it out. And especially 2 years in, we know more about the virus, including when people are able to infect others, what period of time that occurs. And we also have seen, even though I know it's controversial, that a well-fitting, high-quality mask really does allow people to protect others, whether they know they're infected or, again, if they're following the new CDC guidance and coming out. So we really do have to evolve with the science. And we also have to realize that part of living with this is 10 days staying at home, especially if the science doesn't support that you need to be at home that entire 10 days. Again, an average person, it's incredibly disruptive. And we know that guidance has really put people in a bad spot of feeling like, well, I want to follow the science, but I have a job, I have responsibilities, I can't stay at home for 10 days. And so I think really the evolution of this guidance is learning with the virus and seeing, what we can do to protect ourselves and protect others, but also acknowledge that, unfortunately 10 days being at home isolated is a luxury, especially if it's not supported by the science, that's the best way to keep people safe. It really is, again, being vaccinated, getting your booster, and then if you are positive, staying at home for the period that you're most likely to infect people, high quality mask on the other side of that 5 days. And yes, I would follow this guidance.
Part of Secretary McGarrick's answer referred to our need to balance the need for quarantine and protecting with the need for the economy and the world to continue to operate. We just don't have the tools that we did 2 years ago to shut everything down again. And so we're in a new stage, I think, of managing through this, obviously following the CDC guidelines and the science. But I think importantly, thinking about how do we evolve in our approach, as this thing moves on and moves forward.
Yeah, and Governor, if I could just add really quickly, I think a key point that's getting glossed over, if you are still having significant symptoms, the guidance is still to stay home. It's not under any circumstance 5 days and come out. If people are still ill and having serious symptoms, that's a good, and again, I'll defer to our clinical leaders, that's a good indication that you're probably likely to infect somebody. And this guidance says, please continue to stay home. Please consult with your healthcare team. Please consider yourself still infectious.
Dr. Silinski, you're shaking your head. Feel free to jump in if you want to add anything.
That was
to the
exactly what I was
conversation.
going to say. Yeah, that's the key point, is that you're asymptomatic and you're still doing all of those layers of protection that we discussed, which include masks, social distancing, hand washing. So it's on a case-by-case basis, but there are certainly people who have been kept out of work or school who were asymptomatic for maybe 4 or 5 days longer than they needed to be. And this is in an effort to try to get people back to their jobs.
So our healthcare facilities, our hospitals, and our long-term facilities are perfect examples of that. The biggest challenges that we hear from the association, from its members, is members, nursing staff, and other staff who have to be quarantined for the reasons that we're discussing.
Our next question will come from Tim Mastro from the Delaware State News.
Good afternoon, all. Governor, I was just wondering, with the rates of transmission right now, and just looking at schools, you always talk about how schools are kind of that structured environment. And now there's been a week or so where they've been out of that environment, going to these holiday gatherings probably. Was there any discussion with Department of Education or school districts about possibly going virtual after the holiday break? Or will there be increased testing, or what resources will be there for schools as they come back during this pretty big surge?
Yeah, so you've heard me say time and time again that one of our most important objectives is to keep children in schools for in-person instruction. And we know now how bad the negative effects have been. They were out for months and months on time. We also know how safe and structured the environments are. We also know that with our mask mandates, that they're safer there at home than there in school than just about any other place, and that the wearing masks in schools, the children, and I've been in them myself, and obviously they're probably better behaved when I'm in the classroom than otherwise maybe. But that's our objective. And so, as we move into the new year, are we concerned with the surge about whether it can penetrate into those environments? Absolutely. Are we concerned about the fact that the children have been out of the structured environments and safe environments for extended a period of time? Absolutely, which is why the message is, to be careful and then not to do that. And so you're not spreading it from social environments of parents and young adult siblings to the children, because we know, and by the way, it's not just for their own educational and mental health benefits, but when children aren't in school, parents can't go to work. And we heard that loudly and clearly at the beginning of the pandemic with our childcare facilities and with our schools and our hospitals. They can't keep their workers there unless the children have places to go, most importantly for their own educational and mental health benefits. Yes, we do have extra resources. We do now have Test to Stay program, which is enabling us to keep mostly staff, educators and staff quarantined and on the bench for some period of time, get them back in the classroom, and we'll be managing that as we move into January. At our level, there hasn't been a discussion of allowing districts to go remote. My guess is that they've discussed it at the district level in different places across our state. And obviously, I think what we're seeing is spread that's pretty pervasive. It's higher in the lower, less expected, lower vaccinated parts of our state, so central Delaware and lower Delaware, and among young adult population. A lot of those young adults have young children, obviously, and so we're very concerned about the need to get those populations vaccinated when many of them haven't even received one dose. So that's where we think our focus ought to be, and in helping with the possibility of emergency powers, our hospitals, in terms of decompressing. I think I said depopulating. We don't want to depopulate the hospitals. We want to decompress the hospitals, and that's where we hope to provide some assistance.
Great. We're now going to move on to some pre-submitted questions from the press. The first question comes from Chris Barish from WHYY. He says, Governor, what faith do you have that residents who have previously objected to orders of masking, vaccination, et cetera, will now comply with this guidance? And if you do have faith, why do you, and when there's more ample evidence that too many will still not comply?
Yeah, well, Chris has asked this question before, and it's a tough question. The question is, and you've heard me say before, a leader with, quoting my former colleague in the Congress, a leader without followers is just a man or woman out for a walk. And if I as governor, as our healthcare leaders are not able to get people to do what they need to do, get vaccinated, wear masks, then it's we're not going to be able to make progress. And so I think it's time we're at a different stage, as I mentioned before. Our focus at the state level has to be getting more people vaccinated, making sure we understand the questions about the variants and how they spread, making sure we're focused on keeping children in school and making sure they have tests, and our Test to Stay efforts are working. And most importantly now, which is why we brought our hospital partners from Bay Health with us today and from Christiana Care last week, is to help them with the surge of hospitalizations that they've seen. It's not just COVID patients that are in the hospital. There are other patients there too, which complicates and makes it more difficult. But we know the COVID cases are preventable. And so again, getting people vaccinated has got to be job number one. It's time to ask the business community to step up to the plate. We have a mask mandate, all public buildings, public transportation, long-term care facilities, healthcare facilities, our schools, and we struggle to maintain all those and keep them effective. And I think by and large they all, and a lot of private businesses the same, and you get a lot of compliance. I think focusing on personal responsibility as part of the equation, talking about putting a face on the healthcare workers that are so stressed after 2 years of this, and when they get patients, and just the message of let's be kind to the people who are treating us in the hospitals or going into work every day, exhausted and wondering about the next patient that's coming in, and knowing that the patient on the gurney down the hall is not going to get the room as quickly as he or she needs it. That's the kind of a public spirit that we need to see from folks. And coming out with just a strong, the government says do this kind of message, I'm not sure it's going to accomplish what Chris is referring to. And so we've got to really encourage people to come together around that public spirit so that those people who are not vaccinated, who have resisted, will give it another chance, give it another thought. Think about that it's for somebody else. Think about the broader community. We have the jobs to do, hospitals and treating patients, and particularly in emergency rooms with Dr. Silinski and her teams there, making sure that the patients get the life-saving treatment that they need. I have a good friend, I've known him forever. He was hospitalized, he's immunocompromised, he's a good friend to all of us. And thank God he got the treatment that he needed. He's out of the hospital, he's on the mend. But if our hospitals are overburdened and can't provide that service to every person that comes in, then that's a bad situation for all of us. So let's come together, Chris, and we manage this on a kind of a day-to-day basis, determine what works. And, as the cases have surged, we have seen our vaccination rates tick up a little, not where we want them to be, but they continue to rise and increase. And hopefully this messaging, hearing from our emergency rooms at Bay Health, will help people get to where they need to be. And this is a hospital that serves the area with the lowest vaccination rates in our state. These are their neighbors that are working in these emergency rooms that need our help.
Thanks, Governor. The last question will come from Susan Canfora. This is a pre-submitted question. She asks, Governor, if you could please touch on the availability of testing kits, and then separately to the clinicians on the phone, if you could talk about the safety of booster shots, and at what point do they protect an individual from getting the virus?
So I mentioned briefly, so our testing numbers are way up. They had declined pretty significantly as the spread of COVID declined as well. As the holidays, as the numbers started going up and the messages started getting around that COVID was surging, people hear from their neighbors, people at work that have tested positive, they go out and get tested themselves. And so the surge in demand has been pretty dramatic. We estimate that we can do, I think originally CDC was saying that to manage this, we needed to do 80,000. I'm testing my memory now from 2 years ago, 80,000. Secretary McGarrick's giving me the thumbs up a month. We can do now 80,000 in about 2 weeks. Do we have those tests? We do. The term we want to strike the balance between testing too many and having a long turnaround time with the results. We want to keep our results coming back in about 24 hours. AJ Shaw, who's our testing guru, working with Dr. Hong and the team at Public Health, says that now we're at about 27 hours. And so we're meeting that 40,000 or so a week. There's a tremendous demand for at-home rapid tests. And we don't have as many of those. We could use more of those. We heard the president the other day talking about making available a lot more. We've made a request for them and haven't seen any yet, but we'll continue to try to pursue that. But we have, I think it's fair to say, we have the number of tests that we need on a monthly basis, a weekly basis, to manage the demand on a regular basis. Do we have the number of self, at home, and so-called rapid tests? Probably not. Secretary McGarrick, do you want to add anything to that?
No, I think it's what you said, Governor. Unfortunately, we have a lot of tools and a lot has changed since March of 2020. What hasn't changed is when everyone in the country wants something at exactly the same time, we're going to struggle with supply. We hope that evens out. We do ask people to be patient. The president announced that there should be a website up shortly where people can request at-home tests, the half a million he's going to provide. So, more resources are coming. We know it's not happening soon enough. But again, if people think they're positive and they've been around people, just act accordingly, follow the guidance. Don't stress yourself even further saying, oh my gosh, I've got to get this test. Just assume you're positive, go ahead and start isolating, take care of yourself, notify your doctor. It's going to be bumpy for probably the next at least week or so, if not a bit longer.
And I should mention that we do and have prioritized testing for our school populations as well. And I think there was a second part of that question that had to do with boosters. I'll turn it over to whoever else wants to answer that question.
I'll just make a quick comment on that, Governor. The booster shot is extremely safe. I mean, that's just the simplest way of saying it. Again, and it's also very effective. It on average, it increases your antibody levels tenfold. So you have about a tenfold increase in your antibody levels, and you get much, much better protection. And again, the significant side effects from the COVID vaccine are very rare. There is an inflammation that someone can get around their heart, which in almost all cases is mild and goes away in a period of a couple weeks. And those are rare cases, as opposed to, what happens if people don't get the vaccine, and or what has happened for those that did get the vaccine, where the study that I talked about suggested that 35 million cases were probably prevented in the last year in the US. So again, mild soreness and a little bit of achiness is not uncommon, but significant side effects are extremely rare.
Thank you, Dr. Spiegelman. Dr. Silinski, any last word from you? We again appreciate your work and your teams right on the front lines. And I know it's got to be very difficult for all those workers there and what they've been through the last 20 plus months.
Yeah, I just want to add that, the vaccine and the booster, regardless of what the side effects are, as compared to actually having the disease, it's like a different species. It's so rare to have side effects, but believe me, you do not want this disease, because not only does it cause immediate complications, which can result in hospitalization or death, but even long-term, I'm seeing so many patients come to the ED with chronic fatigue, chronic cough, chronic shortness of breath, neurocognitive effects. And if you can prevent getting that, it would be absolutely crucial. So don't be afraid to get the vaccine, and the booster is even more important. Thank you.
Thank you, Dr. Silinski, Dr. Spiegelman. Emily, was that the last question?
Yep, that's the last question.
Well, again, thank you to the media for joining us today. Thank you for your questions. Thank you for your reporting, particularly getting this information, which can be complicated, getting it right and asking questions for clarification. Our message today is really a pretty simple one, and that is that we're seeing, like every state across the country, a surge in COVID-19 infections across our state, much higher in portions of our state with lower vaccination rates. There's a really simple solution, which is if you're not vaccinated, to get vaccinated. And if you are, to make sure you get your second dose and your booster. We just heard from Dr. Sigelman and Dr. Silinski how much more effective it is, the vaccination you received if you've gotten the booster. It's so much better than getting that virus, and you certainly don't want to end up in the hospital. And of course, as you've heard the public health experts on this call talk about today, it's that trying to stop that process of transmission of the virus from one person to the next, from one unvaccinated person to the next, creating a spread and a geometric transmission of that spread across our state. That's what we're trying to stamp down. As we look at the graph that we've had on the screen a couple times now, we're streaking towards the peak of last January 14th of 474, already at 454. We're hopeful that if we pull together everybody takes on that responsibility to be careful over New Year's. Just put off for another couple of weeks a New Year's celebration and not invite the risk of Omicron or Delta getting into your New Year's celebration. Wear your mask indoors, particularly around folks from other households, and just be careful, obviously, around your own family members that are coming and going. I'm always trying to keep track of my two 20-something-year-old sons who are moving around a lot. They're wearing their masks. They're fully vaccinated, but they're also very mobile. And make sure that if you have symptoms, stay home. Make sure you get tested so you're not inadvertently spreading the virus from someone else. Again, as we close out 2021, we're hopeful as we look to the new year. It's got to be a better year from our perspective. Not sure that it can get any worse. I'm more confident than ever if we take responsibility ourselves, do what we need to do, simple things, get vaccinated and wear masks and be careful, then we can get through this thing together. So have a happy new year. Celebrate safely, maybe by yourself or with a loved one, and we'll see you next year.